Here's a presentation of the drug Latuda, presented by Anissa and Pillai. Latuda is the brand name, and the generic name for Latuda is lurasidone hydrochloride. It's an antipsychotic and a dopamine serotonin receptor antagonist. It's indicated for those with bipolar disorder. It's usually used in combination with valproate or sometimes lithium, or it could also be used on its own for those who have bipolar disorder. And then it's also indicated for those with schizophrenia.
Therapeutic effect of lurasidone. Latuda is used to treat schizophrenia by decreasing the severity of hallucinations and delusions. It decreases the intensity and frequency. Latuda is also used to treat depression in people with bipolar disorder. It can contribute to a more balanced emotional state and can be used as a mood stabilizer.
For the mechanism of action, loracidone is an atypical antipsychotic agent that acts as an antagonist at the dopamine type 2 and the 5-HT2A receptors. So, in summary, it blocks the dopamine and serotonin receptors.
Pharmacokinetics of lurasidone. The bioavailability of Latuda increases significantly when taken with food. Patients are encouraged to take the medication with at least 350 calories. Latuda is highly protein-bound, meaning that the majority of the drug binds to plasma proteins and is distributed throughout the body. Latuda is metabolized by the liver enzyme CYP3A4. Patients with hepatic impairments are at risk for medication toxicity because they are unable to properly metabolize this kind of drug. The half-life of Latuda is approximately 18 hours. About 80% of the drug is eliminated through the feces and 9% is eliminated through urine.
Loracidone is only available orally. You can get it with the 20 milligrams, the 40 milligrams, 60 milligrams, 80 milligrams, or the 120 milligrams. The maximum daily dose for loracidone is 120 milligrams. For bipolar disorder, the usual range for it is 20 milligrams to 120 milligrams. But for schizophrenia, you initially start with 40 milligrams, and then the max for that is 160 milligrams.
Common side effects of lurasidone include drowsiness, weight gain, tremors, muscle stiffness, slow muscle movement, feeling restlessness or being excitable, nausea and vomiting, runny nose, and sleeping problems.
When taking loracidone, it's important to note adverse effects. These include orthostatic hypotension, syncope, tachycardia, diarrhea, esophageal dysmotility, xerostomia, and granulocytosis, leukopenia, neutropenia, transient ischemic attack, and Parkinsonism.
Contraindications. Contraindicated conditions for lurasidone include cardiovascular disease, liver impairments, and kidney disease. It is not recommended for older adults who have dementia because it has been correlated with an increased risk of death. It is also contraindicated in pregnancy, breastfeeding, and for people that are dehydrated. In pregnancy, it can cause problems in the fetus or newborn if taken in the last 3 months of pregnancy. And it is not safe for breastfeeding because it can pass through the breast milk to the infant. For dehydration, we want to encourage our patients to be drinking plenty of fluids when taking this medication.
So, for our drug and food interactions, it's important that when we're taking loracidone, we shouldn't be using it with strong CYP3A4 inhibitors. This includes clarithromycin or taking it with grape juice, because this can increase the blood level of the medication, increase our risk for the side effects and the adverse effects. And then another one is our strong CYP3A4 inducers that includes rifampin and St. John's wort. Alcohol is another one because it can enhance the blood pressure, lowering the effects and increasing the drowsiness of loracidone. And then one last thing is to make sure that we take loracidone with at least 350 calories of food for increased bioavailability.
Nursing responsibilities. Monitor for mood changes such as anxiety and agitation. Manage side effects such as drowsiness, restlessness, and runny nose. Administer this medication at appropriate times. Provide education on medication indications, intended therapeutic effects, side effects, and adverse effects to report. Monitor blood sugar and prolactin levels in patients that are taking this medication and reinforce education as needed.
Some labs and tests that we should look at when taking lorazepam include checking the fasting blood glucose and hemoglobin A1C. This is important to detect any hyperglycemia or any new onset of diabetes. We want to make sure that we're looking at the lipid panel. This is to monitor for hyperlipidemia because it can increase triglycerides and cholesterol levels. So, with that being said, you want to monitor any weight gain as well. You want to do a complete blood count to monitor for leukopenia or neutropenia. Like we said before, an adverse effect for lorazepam is uh, a granulocytosis. And then you want to check your basic metabolic panel. This is especially if the patient is on any other medications or is at risk for dehydration. So it's important that we monitor our sodium and potassium levels and then as well as our kidney function. So looking at our BUN and creatinine ratio is important as well.
Question 1. A patient has been newly prescribed lorazepam. The nurse provided medication education. Which one of the following statements made by the patient indicates a need for further teaching? A. I should avoid drinking grapefruit juice when taking this medication. B. I may feel drowsy when taking this medication. C. I will take lorazepam on an empty stomach. D. I should report it if I feel dizzy when sitting up from bed. The answer for question 1 is C. I will take lorazepam on an empty stomach. The rationale is that lorazepam should be taken with food, ideally at least 350 calories. Question 2. The nurse should question the lorazepam order for which patient? A. A patient with schizophrenia. B. A patient with severe kidney impairment. C. A patient with bipolar disorder and depression. D. A patient with a BMI of 22. The answer to question 2 is B. A patient with severe kidney impairment. Lorazepam is contraindicated for patients with liver or kidney disease. Poor excretion of the medication can lead to toxic levels and increased risk for adverse effects. Lorazepam is used to treat schizophrenia and depression in bipolar disorder. A patient with a BMI of 22 can take lorazepam. Question 3. The nurse is teaching the patient about lorazepam. The patient states, I will wear it as a patch. Which statement is the best response? A. Remember to take the patch off before showering. B. You can remove the patch if there is any itchiness. C. It will be better if I inject the medication for you every morning. D. Lorazepam is not available as a patch. The answer to question 3 is D. Lorazepam is not available as a patch. The rationale is that lorazepam is only available as an oral medication. The other options are false and utilize non-therapeutic communication.
Thank you for watching our presentation on the drug Latuda. Again, this was presented by Anissa and Palai.